This is for Mr. Sloan's animal science class. My name is Lily. We're going to be doing a well animal check on Maisie. This is Maisie. She's a boxer. She's a very pretty girl. If you guys want to get out your well animal chart, we'll go over everything in here and in this video, and I'll show you how to fill it out. So, the first thing you're going to do is write down the kid's name. So on here I wrote down Maisie, and then I did the date. It's 9/16/2020. So 16th of September 2020. Okay. So the first one is attitude. There's BAR, QAR, and depressed. BAR stands for barking, attentive, responsive. QAR is quiet, attentive, responsive, and then depressed is depressed. So if we're looking at Maisie, and we're looking at her, what she's doing right now, she is quiet, attentive, and responsive. She's not barking. She's a little whiny, but that's just because of anxiety. Yeah, so then the next one is appetite. Maisie's not my dog. Her owner is behind the camera. So for this, if we were a vet or something, we would ask Fiona. We would say, hey, what's your appetite like? So Kaylin, what's your appetite like?
She eats normally 1 cup of food at night.
Fantastic. So
And treats throughout the day.
So appetite, you're gonna write down normal, or you can talk about like what she eats. She gets treats. She eats quite regularly. Yeah. So you can write it down normal. Do that. The next one is CRT. So that's capillary refill time. So in parentheses it says color, CRT, and hydration. So that's all about her teeth. So if you want to come closer, we're gonna lift up her gums. Oh, slobbery. And you're gonna look at her teeth. She got cute little baby teeth. You can kind of see them right there. But she's got really pink gums, so that's a normal color. We'll write that down. She's slobbering. I would assume she's very hydrated. Her nose is very wet, hydrated. But we're gonna try and get a good press on her gums so we can see the capillary refill time. So that's really good. For the capillary refill time, you want it to be 1 to 2 seconds, so it's completely back to normal, and hers was about that. So we're gonna write down for color, pink, or normal, capillary refill time 1 to 2 seconds, and then hydration, hydrated, normal, anything like that. And then, from what we saw in her mouth, dental, her teeth look really good. I know her owner brushes her teeth. And they're very white, not very much plaque, just normal kind of plaque. You can see, oh, no, not right now. But yeah, so dental, say good, normal, excellent, really just depending on the animal. For Maisie, I would say excellent. She's got very nice teeth. Eyes. So we're gonna turn her a little bit so you guys can see her eyes. Her eyes are very pretty. She doesn't have a little bit of eye bugs right now, but I know she has allergies. So sometimes dogs, like humans, will get eye boogers from allergies.
And she has a little dry spot on the center of both eyes because at night, well, just in general, her eyes don't fully close. The vet said that that's fine, but if you see a little dot, that's what it is.
Yeah, so that's normal for some dogs. It's just like something they were born with. They can't really fix it. A lot of pugs can't close their eyes all the way, so it's something that's pretty normal in dogs. So for eyes, we're gonna write normal, and then you can make a side note that says slight discharge due to allergies, or you could talk about, or just make a note that her eyes don't fully shut all the way when she's sleeping, so there's a little bit of crusty from that. Okay, so the next thing on our list after eyes, sorry, we just had to take a little break for Maisie, she wants some water, are ears. And ears are very different, it depends on the type of dog that you have, because I used to have a Basset Hound and their ears are very long and they drag over the ground, so they get dirty very fast. Maisie has pretty small ears, they're pretty high up on her head. As you can see, they're very pink. Looking down in them, they're a little dirty, but about normal dog ears. They're not going to be perfect. Go to the other one and look in that. Also the same thing, a little dirty, but that's that's normal. There's no smell coming out of them, so you know she doesn't have an ear infection. There's no pus or like gross black dirt. It's just like earwax, normal. Probably need to be cleaned in like a few weeks, but other than that, pretty fine. So for the ears, right down normal as well. And you could also make a note that she's got a little bit of dirt, but that's just normal buildup. Alright, we're back with the lymph nodes. Now the lymph nodes can be kind of hard to find and they're difficult to remember where they are, but I'm going to try and show you to the best of my ability. So we're going to get Maisie around. So the first one on the list is cervical, and cervical is kind of on her chest, about right here I think. So you're just going to feel around, make sure everything seems normal. I don't feel any swelling, that's fine. And then we're going to move on to her scapular, I don't know how to say that. But that is further down. So cervical's up here, and the scapular is like right here where her legs would connect to her body.
Can you show it again?
Right here.
Well, no, the difference.
Cervical is up here towards her throat, and then the one source of the P is down here towards where her legs connect to her body. Yeah, and I don't feel anything there either. You're a good girl. And those are right behind her legs. So you're gonna feel right here. I don't feel any swelling there either. Seems pretty good, Maze. Doing a good girl. And then the third one, not third, fourth one is sensitive eye. I don't know how to say that either. I'm not gonna try. But it's the one that starts with an eye. And that's right here. So you're gonna feel it on the beginnings of her other legs where they connect to her body. You're just gonna feel around, make sure you don't feel anything hard or abnormal or any kind of swelling. Feels pretty good. And then the last one are the popliteal. I also can't say that one. So that's easy. And those are right here on the backs of her legs. And again, we don't feel anything. She's pretty good. She's a very healthy, happy girl. So for that, you can just like normal for all of them, or just normal ones. Yeah, pretty good. Next are lungs. Lungs, I mean, she's breathing. It's hot in the greenhouse right now. So she's breathing a little heavy. She's panting. She's trying to cool herself off. But she seems to be just breathing fine. We were gonna move on to heart, but since we have a stethoscope now, we're going to put it on and listen to her breathing and then move on to the heart. So for this, I'm just going to put it in my ears, and then I'm going to hold it up to her chest and listen to the way she's breathing, see if it's raspy or if there's anything to be concerned about. So she sounds really good, breathing normally. Like I said before, she's breathing a little fast. It's hot in here. Yeah, so now we're going to listen to her heart rate, and we're going to find her average heart rate. But the average heart rate for a large dog is anywhere between 120 beats per minute to 160 beats per minute. So as long as she's in that range or close to it, she's completely fine. Yeah, so for 10 seconds, I'm going to count her heart rate beats, and then Kaylin behind the camera is going to tell me when 10 seconds is up, and then we'll do a little bit of math. So, ready? Alright, so we just recorded Maisie's beats per minute, and it was 125, so it's a little bit above the lowest average, which is fine. Yeah, so if you're doing this at home to your own animal, depending on the size, look up the average. So if it's for a rat, it's going to be different than it is for a large dog. If it's for a puppy, the large dog and puppy are around the same, but a smaller dog, so I have dachshunds at home, it would be, I think, faster. So the average beat per minute, if they're smaller, would be faster than a large dog. So the next thing is abdominal cavity. So for this, we're just like feeling her abdomen to make sure that nothing's going on here and that you don't feel any like bad bumps or anything. Feels pretty good. I don't feel any weird bumps. Yeah, so she feels good. So I'm gonna put normal.
for abdominal cavity.
Next is coat. So we're gonna look at her coat, make sure she doesn't have any fleas. Maisie's fur is white, and the underside of her skin, that's what I'm trying to say, is pink. As for most truly white dogs or other animals, the skin will be pink. Then she has spots, so you can see the spots through her coat. She's a short hair, so sometimes it can be hard to see if she has fleas. But she's white, so you would be seeing them running around because fleas are normally dark brown to black. You could get a flea comb for your dog, a brush, and just make sure that the coat is soft and good. Maisie's coat is very soft. She's bathed. She's well taken care of. Her hair is falling out, but that's just normal hair shed. Yeah, so that's good. So for that, put good or normal. Next is nails. So you're gonna want to check out the front and back nails are all different. So we're just gonna pick up her feet and we're gonna look at her nails. They're recently clipped. They're looking pretty good. She's got very nice feet. She doesn't like it very much, but yeah, she's got very nice feet.
She has white nails, which
Yeah.
makes it nice for when you get them done.
Yeah, so you can see the quick to make sure that you're not clipping the quick and hurting her in any way, because if you clip it, it'll bleed and it's very painful to the nerves. Just like when you cut your nails too short, it's uncomfortable and very painful. So for that, we'll put normal as well. The next thing is musculo or skeletal, so that's just checking out her spine and all of her joints and her bones, making sure that there's no issue. Most of the time you can ask the owner, be like, is she's walking funny? Does she look like she have any hip problems? Just stuff like that. You can feel around her body.
She does have hip problems because she's a rescue, so we think she was probably hit by a car or something, and so she has slight hip issues.
But yeah, so she's got a little bit of sensitive hips, but other than that, she seems pretty good. Her spine, feeling it, and her shoulders feel fine. Yeah, she's a good girl. Respiratory rate, so that's the heart rate that we just did, or the breathing rate. So the respiratory rate and the heart rate are very similar. So it's breaths per minute instead of beats per minute. So how many breaths is she breathing a minute? You can listen and count just like we did for the heart rate. Excuse me, sweetie. So you can just do that. I'm not going to do that with Maisie right now because she's breathing rather heavily instead of normally, because she's nervous and it was warm out in there, so we're just outside now to cool her off a little bit. And then heart rate, we did the heart rate earlier. It was 125 around. I'm not, an expert. And then the next one is BCS, so this is body composition score. So in the common documents on the animal science thing, Canvas, there is a chart that shows 1 to 5, 5 being obese and 1 being too skinny. And then you're gonna look at that score chart if you're doing this at home, and you're gonna rate your dog comparatively. So Maisie is a little bit on the thick side.
She's 60 pounds.
She is 60 pounds. But if you look at the body composition score, she'd be a 3, maybe a 4, because she is fairly skinny, but at the same time she's a little thicker. So she would be a 3, maybe a 4 if you're being picky. Yeah. So, and then the last one is pain. She doesn't seem like she's in any pain, walking around, running around, that's fine. So that concludes filling out the chart. There are some other things you could do on your own dog, if you're not following along with Maisie and just using this for a refresher, or not even dog, cat, rat, goat, doesn't really matter. Just make sure if you are doing like side notes or whatever, you write down what they are and why you're making them on the side of the paper. The Well Animal Check sheet has quite a lot of room on the sides. Thank Maisie for being such a great test subject.
Maisie May.
Yeah. She's gonna get lots of treats for this. So, thank you so much for watching. Have a great day. Bye bye.